Are you okay?
No, sorry. Whew. Oh, well, hey, everybody. Welcome to the Sights and Sirens Back to Basic podcast. Today is May 4th, and as you all know, may the 4th be with you. So we want to actually use this opportunity to talk about something that we don't get a lot of, I think, in medic school. I didn't get a lot of it in medical school either. And something worth kind of just taking back to basics and thinking about because we don't get a lot of formal education on it, and that's lightsaber injuries.
Right. We don't see that often. It's something that we need to know.
Right.
Before we get into it, let's just talk about our sponsor today.
Absolutely. So we're going to sponsor ourselves again today.
I love sponsoring
We've got a great NREMT prep program. If you are studying for the NREMT or knows anybody who is studying for the NREMT, check out our program at sightsandsirens.com. We've got 15 hours of video content. We've got questions, and we've got workbooks.
Live lectures.
We have a 94% pass rate. Let us help you help yourself to pass that National Registry exam.
I like it.
Yeah. So, again, like I said, and this is something, like I said, I'm excited about this topic today. I think it's kind of like, on
it's
on
not
theme.
done. No one's done it yet.
No one's done it yet, which is crazy to me. Yeah.
There's been a few times that I feel like we've done a video on something, and then we've seen, some other podcasts and stuff, or like some other programs like cover the topic too. And I want people to know, like, we're the first to do this. Like, I haven't seen anything on it.
Right. Which is crazy because, again, I think sometimes you have to practice and spend more time studying things that you see less of.
Right.
And for me, lightsaber injuries is definitely one of those.
In the fire service, we always call it like it's a low frequency, high risk scenario.
For sure.
Right? Like, we don't see them that often, but when they do happen, like, we better not be on our back foot.
I think there's a lot of misconception around lightsaber injuries, and this is what we see a lot. So, I'll give you an example. I said we like to kind of like throw cases out there. So, we use the most common one is that when Luke gets his arm chopped off, right, by Darth Vader.
Is his hand.
It's his hand. I'm sorry. Yes, it's a hand. So he gets his hand chopped off. And like he doesn't die right away. He's I'm sure in a lot of pain, but he's okay, right? He's still obviously able to climb quite a distance with just his other arm. But there's no blood, right? There's no blood. So people assume then, which makes sense, like, okay, so like lightsaber injuries cause cauterization of the vessels and the arteries and everything. And that's actually not the case. And this is, like I said, kind of taking it back to basics, is that lightsaber injuries actually cause a vaporization of tissue. So you don't get bleeding, but you get, like I said, because it's essentially like a laser power source, you're getting vaporization of the tissue, not cauterization, which is a little bit different. I think there's kind of something that we need to be aware of. So in the spirit of taking it back to basics, we need to talk about not only how these present, but I think, like, again, like some of the mechanisms of injury and stuff like that. So starting out with, what is a lightsaber?
Right. Big misconceptions, okay? A lightsaber is not a laser sword. And, like, that's like a generic term that people throw out. It's not a laser sword. Mm-hmm. You sound silly when you say it's a laser sword.
And that's the thing. Like, if you're an EMT or you're a medic and you're using the term laser sword out in the field, I think you have to, like, I don't want to be harsh, but you need to, like I said, we're going to take it back to basics today. I don't want you to make that mistake and embarrass yourself in front of your colleagues.
Be more professional. If I was injured by a lightsaber and you came in and you're talking about how I got injured by a laser sword, I'm going to a different paramedic.
Well, you're going to lose confidence. You're going to lose confidence.
You just don't know what you're talking about.
For sure,
right?
Exactly. So what is a lightsaber?
It's like if I got shot by a gun and you were like, did you get hit by this boom boom stick? Like, it's stupid.
Right, yeah.
It's just stupid.
Kind of ridiculous. So again, as I said, we don't want to be harsh, but just we need to make sure we're defining terms well. So again, so what is a lightsaber exactly?
A lightsaber is a laser energy field that is being conducted through a crystal, commonly known as a kyber crystal, right? So it's not just, it is a heat source. There's more mechanics. It's not just a crystal. It's not just a laser energy field. You have to have the combination of the two, right? Which is why I think it's such an important part of Jedi training, is building that lightsaber and understanding the mechanics of it, so you can kind of be one with your weapon.
When we do this too, like I said, understanding those basics helps you be a better provider in medicine. So same kind of thing. If understanding how to build your own lightsaber is going to make you a better Jedi, right? I mean, just by default.
And I think personally, like, even as simple as scene safety, like knowing how it works, you know that you can disarm that very easily, right? If I remove the kyber crystal from the from the housing, or if I deactivate it, like, we don't have to worry about it accidentally going up. It's the same thing. If I show up on a car accident, I'm going to put that car in park. I'm going to make sure airbags haven't deployed, right? Absolutely. If I show up on a lightsaber injury, like, I'm going to make sure the lightsaber is secured. A lot of times PD can do this for us.
Yeah. Well, and that's the thing too, and that's why, like I said, we need to go over this more often. Another thing, talking about scene safety, like I said, for instance, like, you never want to put yourself in harm's way. If there are Sith present, I think you need to call up backup resources before you treat the patient.
Right. Like, see, you got a uphill, upwind stay away from that kind of stuff,
Right,
right?
yeah,
Like,
right.
First and foremost, am I prepared to enter the
this
environment?
is
even?
kind
Now,
of
if
a
you're a
given.
force user, it's different. Like,
if
if you feel like you know what I mean? But this is something that should be reported to the council.
Right.
Like, and I say cops can secure the lightsaber with the right training,
Right,
right?
yeah,
Like,
yeah, yeah.
ideally, a Jedi Sentinel is going to come and take that into custody. That's going to be the easiest way to do it.
For sure, exactly.
But generally, just to kind of walk you through the
and
process.
this is kind of a given too. Like if I show up and Darth Maul's there, I'm not gonna engage.
Right.
It's just kind of that.
Exactly.
So we're kind of like beating a dead horse a little bit. This is probably obvious to a lot of you,
which
but
I think is a big part of just avoiding lightsaber injuries in the first place. Like,
Right.
most people
prevention
that
is
are,
always going to be the better
right,
route to take. Right?
100%.
You
And,
want
like,
treating a lightsaber injury should be like a last resort type of thing. Like things have escalated at this point. Right. I mean,
like don't be upset if you get a snake bite if you jumped into a pit of vipers, right?
Right.
So like without a master present or at least some backup, like just don't engage in, people. Don't engage with Sith. Don't engage with Force users that might be,
Yeah.
And we see accidents. I mean, cantina accidents all the time.
Mm-hmm.
It happens. So anyway, basically, process of the lightsaber is you have a housing that contains that energy field. It does like initiate a spark. It generates power, and then that power is conducted through a Kyber crystal. Now, only Kyber crystals are going to do it. They can be difficult to find since the fall of the Empire, but that's why Jedi quest for them, right? So
sure.
And then the color of the Kyber crystal sometimes has like more emotional connection and force connection than like people realize, but the color is going to determine the color of the laser, and then a lot of times how the housing's built is going to determine the stability of the field. So you might have more of a solid glow, more of a vibration, like unstable. Like it's very popular with Sith to have like unstable cores, so that it gives it a cooler look, and it kind of helps them channel the instability of the force powers that they use. Right. But it's a little different now, but typically, a Jedi Guardian will use like a green lightsaber. Those are more the people that are into meditation and are kind of the wiser, more into teaching and the concepts of the Force. They're more likely to use Force abilities than they are going to be using the blade in general.
Right. Which we'll talk about, I think, in a little bit here.
Sentinels will use yellow. We saw that in some of the newest renditions of history. Sure. And then typically like a more of a fighter or like the police officer type like Jedi is going to have the blue blade. The blue. Mm-hmm. So sometimes like we see most commonly in Luke's transition from going from the blue blade, and then now he's more focused in the Force. So he's built a green lightsaber at that point. He's using that kind of. And there's disagree. This doesn't mean like I'm certainly not gonna group people in these categories. Disrespectfully. It's not like you shouldn't walk down the street and if you see someone with a blue blade, assume that they like fighting styles over using the Force. Like they might be very adept in the Force and they just chose blue for other reasons.
Yeah, maybe it's their favorite color.
It might be access.
Oh, that could be too. Yeah,
it might be access
nowadays,
because this
they
isn't
have access to another one. So that's okay. So we got to understand like what we're using here in terms of weaponage. But the other question is though. So like I said, because there's this misconception about the cauterization, that sort of thing. What is going to actually kill you in a lightsaber injury, right? We're EMS, we're emergency professionals. What's actually going to kill you? And it's not going to be hemorrhage, right? Like we're getting vaporization of these tissues. It's not going to be hemorrhage. Now, if you have intra-abdominal wounds and things like that, again, whether you're piercing someone's abdomen, obviously it's like a decapitation or going into someone's heart. That makes sense. But you're not going to see, like I said, this massive hemorrhage. So you're not going to get hypovolemic shock.
Right.
Typically, what you're going to get is a distributive shock. So let's quickly just talk about like the different types of shock and why distributive shock is what we're going to see in major trauma from lightsaber injuries.
Right. If we talked about hypovolemia before, right, that's going to be loss of volume.
Right.
But again, we're not losing volume. We might be losing relative volume in a certain area because of internal bleeding. Right. So it's not so much that I'm bleeding out. I'm not exsanguinating out of the wound. Right. So let's use a famous example. I think that people misunderstand it is Darth Maul. He got chopped in half, right? So yeah, he's not bleeding actively right now out of those wounds because of the vaporization.
Sure.
But you better believe there's hollow organs now that are filling with blood that have been perforated. Like we have issues. We have blood in the wrong places, right? And when we have blood in the wrong places, we call it a distribution issue, right? We have blood not going to the right places.
Right.
So the biggest threat to something like that is a distributive shock issue.
Exactly.
Where is the fluid going?
Right. And distributive shock. So you're losing that that volume, but not in a, like I said, not in a hemorrhage type of situation, right? Like all the vessels are going to dilate, trying to get blood back to the heart. The other thing, though, is that there may be a relative hypovolemia because of how quickly and efficiently the lightsaber will sever a limb. All of that blood volume that was in that limb is now gone, like instantly.
Right.
Whereas, like, if with more modern weapons, like you said, if you shoot someone with a bullet, like things are going to constrict in different areas and try to stop bleeding. We're not seeing that, right? Mm-hmm. So if you think about it too, it's like this relative hypovolemia. So when Darth Maul's cut in half, he loses half as his volume, but he only has to provide his heart half the volume that was there before because he only has half a body. Right.
And when I refer to relative hypovolemia, I'm more talking about like is it in the right space, right? Because we usually refer to like the volume as like the intravascular space because the vessels are what's feeding those tissues, right? So if we can't have the blood there and it's in other places, like we still have the blood, but relatively we don't because it's in the wrong spots. So then the trick becomes, like any kind of shock, it's going to be your first is going to be stabilization, and that's going to be usually with fluid volume. We got to get enough fluid into the vessels, right, in order to, and then let the body do the rest.
Yeah. Now, in your, and like I said, we haven't had a ton of experience in this, but like in your limited experience, do you typically, do you treat it like a normal trauma where you would establish an IV and like, let's say, like said, there's an amputation of the one arm, would you establish IV in the other arm? Is there any benefit in doing fluid hydration in this like same?
I wouldn't do it. I wouldn't do it in the same space because I think that you're propagating where you're gonna. So if you have a severed hand, you're going to have pooling in that area. Like you 100% are going to have pooling in that area. Like eventually you're going to start seeing swelling.
Right.
And then you can start dealing with like compartment issues depending on how bad the burns are.
Right. And that's the thing. So actually let's stop there really quick. So you're not only going to have potential, like so we see a lot of amputation injuries and like a distributive shock. We're also going to see burns. And we're going to see maybe compartment syndrome and swelling and that sort of things. These are all things like in a normal trauma, but it's different. It's different because of this vaporization,
The key is that we're always going to come back to what can we do right away, because that's my job. It's to do stuff right away, right? It's not going to, I don't have to deal with the risk. And we'll talk about, like, we got infection risk. We have C-spinal mobilization. We got all kinds of stuff, right? My first and foremost concern a lot of times with these injuries is going to be fluid resuscitation. It's going to handle the distribution issue. It's not going to necessarily solve the problem, but it's going to put a Band-Aid on it where we have enough volume that we can start perfusing the tissues that are good to go, right?
Sure.
We know that with this type of just removal of parts of the body, we have a distributive shock. We also know that with any type of burn, a lot of times we deal with distributive shock, because with burns, especially third degree, second degree burns, that we're going to have from this, it's how the fluid shifts. We have fluid shifts out of the cells into, they start leaking into the tissues because we're trying to heal that area or repair that area.
Right.
And now we need copious amounts of volume to make up for that.
Right. Yeah. So big thing. So distributive shock is going to be the main concern. Treatment is going to be aggressive fluid hydration. So anyone who suffers a major lightsaber injury, we're going to do aggressive fluid hydration. In terms of, we did an amputation episode. If you guys go back and listen to our amputation episode, it's a good episode. Especially when we're seeing amputations, this is not going to be a case where we're going to be able to reattach that limb.
No.
So you just don't worry about preserving that limb. It's just because of the vaporization issues, you're just not going to be able to.
We're dealing with cybernetics now versus like, your own body. That's why, Luke had to have. And what's interesting, this is kind of interesting. Like you can't, we see Luke doesn't have a hand, then he's got a robotic hand, right? And we think, oh, good to go. Well, what had to happen because of the necrosis of the tissue from the heat and from the vaporization is they actually had to amputate higher up and then attach the cybernetics because none of that tissue is salvageable. You can't attach the burnt ends of your limb to cybernetics and get neural conduction, right?
Yeah.
So you're going to have to they're going to have to amputate higher up and then attach that limb.
And people don't realize how much physical therapy, how there was like a series of surgeries he had to go through.
Well, but the thing is you got to remember the means and resources that someone like Luke Skywalker has over like one of us, right? Like if you have access to a Bacta container and you can do full immersion,
sure,
you know what I mean, and we see that, right?
Yeah,
he gets of course he heals faster, right? It's Bacta, But the average individual, average income household wouldn't ever be able to afford that type of Bacta treatment.
That's true,
right? So we're stuck with more antibiotics. We're going to have to amputate. We're going to have to attach. It's just a lot. It's going to take more time, more energy, like you said, dozens of surgeries, physical therapy, and not to mention the emotional impact it's going to have on you of losing that limb. And it is a huge road to go down. This is where I think people, I know, like, we judge Sith based on their act. Like, it's obviously an inappropriate way to use the Force, right? But like, we can also understand like some of the things that these individuals have gone through. Like Darth Maul getting cut in half, you've got to realize he fell down a shaft, right? So it's not just that he lost his legs. We now have bleeding. We have internal organ damage. We have bleeding. We've cut off, major neural system issues. Then he falls down that shaft. We've got C-spine issues. We've got head injuries, possibly major issues that we've got to get through. And I'm getting like emotional talking about it, but the kind of fortitude that these guys have to have, I mean, the kind of fortitude that he had to have to get through the surgeries, to get through the potential complications, the physiological issues, the mental issues that you're going to have in order to have mechanical spider legs attached to you is insane.
Yeah, for sure. Well, we don't, and then this is something like, not only do not talk about this issue, we don't talk about the amount of PTSD these guys have. I mean, after lightsaber injuries.
And it's not just, and this is why I think, God forbid, civilian injuries with lightsaber, like they, just the stats are showing like they just don't make it compared to Force users. Like Force users have a better time sustaining these injuries because they have crazy amounts of training and not only physical conditioning but also mental and spiritual conditioning too, right?
Sure.
Like that's why people who do yoga have better times recovering. It's obviously an extreme example. I think Jedi training is a little bit more probably intense than goat yoga or something like that, but
it might not be. I'm not really sure, actually. I'm not too familiar with the training.
I've dabbled a little bit and it's pretty aggressive.
It's pretty aggressive. Yeah. No, I can imagine. I've dabbled in yoga, and that's pretty hard. So I don't know if that's
true.
Similar. But and that's the thing, too. So kind of going back to, like you said, being able to deal with these injuries, there is a little bit, what's kind of nice is that especially with lightsaber injuries, because of that vaporization, because you're going to damage nerve endings. So there's like a reason that like Anakin can lose all 4 of his limbs and continue to, what am I trying to say? Stump crawl across the ground is because he's not passed out. I mean, like the pain is there obviously, but not. It's like I said, you've got some nerve.
Yeah, I think that the tears and the screaming we're seeing there is more of an emotional response from the feeling of betrayal and this big life decision that he's made, rather than pain, because you are not going to have pain, right? Later down the line, you may have things like ghost pain, like amputees have. Like it's upsetting, but. At least that part doesn't hurt. You know what I mean? If it's a limb severing. Now, I think personally that you may have so some of the ones that I've seen, like we think like, 3rd degree burn in that area. 3rd degree burns don't hurt, right? Well, heat transfer happens, right? Whether it's from a laser energy field or not, like heat transfer is going to happen. So you are going to get, at least internally, damage to tissue closer to the body, right? Up the stream.
Well, with any burn injury, like you can't just have 3rd degree burns. Like you have 3rd degree burns surrounded by 2nd degree, surrounded by 1st degree. It's a bullseye pattern, we call it. So you're going to see that in lightsaber injuries as well, because it's a different type of burn. You know what I mean?
Right.
Like, it's probably even different than like an electrical burn. It's just it's its own, it's its own type of burn. But I think that does bring us to risk factors for complications. So again, we've kind of what we've covered here. The major life threat in the beginning here of all lightsaber injuries is going to be distributive shock. Aggressive fluid hydration, that's going to be really important. Obviously, we're going to try to treat pain and those other kind of like concomitant trauma that could have occurred. Yeah. But then the next big risk the patient is going to run into is complications from those injuries.
Right.
And that's going to be the same kind of complications we see in burns, right? It's going to be infection. It's going to be fluid shifts later on. Hypothermia, you've lost that protective layer of skin. So you're, especially if you've had multiple amputations or multiple, that sort of thing, like hypothermia is going to be a risk factor. So I said infection, I think burns and that hypothermia, fluid loss in that way are probably the main things we're going to see.
Yeah, so and this is a good question for a doc, because I've read some articles recently and we've had some discussions, when we're talking about trying to calculate fluid resuscitation for someone with burns, right, with 3rd degree burns, but we're dealing with lightsaber injuries, it can get a little crunchy, because typically we use the Parkland burn formula, right? In order to do that, a lot of times we start with the rule of 9s. Right. So 9% for each arm, right? 18% for the front of the torso, 18% for the back of the torso. Like we do that math.
Yeah.
If I've had my arm chopped off, it's a burn injury. Am I counting that 9% or not? Because it's gone.
That's a good question. That is a really good question. So technically, no. So we don't use the Parkland burn formula. We use the Count Duco formula. where basically you're gonna remove those bodies and you're gonna reassess the 9s after that.
Okay.
So you're
Well,
gonna
it makes sense
subtract
because we're trying to
9.
resuscitate fluid. I guess, now that we're talking about it, it makes sense. We're
Yeah.
trying to resuscitate fluid for the body that's there, right? Not the piece that's laying on the ground.
Right, exactly,
So
yeah.
why would I include the piece in
You
this
wouldn't
stat?
include that, yeah. So technically, like I said, if you cut yourself off, cut an arm off, and you just had the stump there, that's kind of like one hand
Right.
worth, which in this type of formula would actually be 3.75%.
Okay. And then the other big question that we had was someone like Kit Fisto, right? We have tentacles on our head.
Sure.
How much percentage for each tentacle? Like if we get 3 chopped off, what am I counting? What is it like? Is it like the hand where we're calling it 1%? Like his tentacles are a little bit. And I hope I'm not being disrespectful by calling it. I don't really know. Do we refer to that as hair? Like I'm obviously not trying to be offensive in any way.
But it's I don't think.
But anyway, for each one of those,
Sure.
are we counting that as 2 or 3%? Like what would you say is kind of the good math there?
I think that again, you kind of can take it back to the rule of palms, right? So in each. So, like, the way we do it is essentially 5 suction cups on a tentacle equals 1 hand. But
I guess that makes sense. I guess it's how many hands we can go up back to the head, right? Because the head is going to be.
If you grip in a circular fashion the tentacle and you can wrap 2 hands around it.
Yeah, I guess that would
be like 2
simple
hands.
way to do it because it is body surface of the hand.
Mm-hmm. Exactly.
That's intuitive, sure. Yeah, I like it.
Anyway, so just there's little nuances there with some of these things. So again, we talked about like other injuries that can occur. So I think we've gotten a good understanding of like what we're going to see with lightsaber injuries. The other thing though is, and we've referenced this a lot of times, most people using lightsabers are going to be Force users, right? Or at least have dabbled in the Force a little bit.
Yeah.
So they're usually used together, right? The lightsaber is usually not used independently as a weapon. We do see that sometimes.
I think the amount of focus you have to use a lightsaber effectively in a battle with other modern technology that's out there. You know what I mean? Like, you have to be supplementing that with Force abilities too,
Right,
Just
exactly.
in order to be effective. So it's like. It's like entering a battle without any training on the weapon that you have. You know what I mean? It's the same thing. You got to have the Force abilities too in order to kind of bring those together and really focus.
So we see a lot of Force injuries with lightsaber injuries as well.
Yes.
So when we think about this kind of like multi-system trauma, we need to think about these other things that could have happened, right? So in Force injuries, we're going to see a lot of throwing people. Right, this is kind of a common, just like
we're dealing with pushes or pulls. Really, like when we break it down, like even a choke. I mean, it's a push from the ground. It's
take
going
it back
up.
to
So,
basics. Push or pull injuries.
push, pull, and I
basically.
guess we could talk a little bit about asphyxiation. You know what I mean? Because that is a common set technique.
Yeah.
So, but regardless of the direction, like we need to be familiar with the direction that it's going. What's interesting about the Force is that. People chalk it up to a mystical force. It's not. There's science behind it, but it's just too much to go into in one podcast.
Sure. Yeah, absolutely.
If we look at internal structures and how they're moving with the force, this isn't the same as getting blown back by an explosion, okay? Because the force is acting not just on the exterior portions of their body, but the interior portions as well.
So you're not getting like deceleration injuries like you would in a car accident where your body stops but your organs keep moving. Everything's being pushed.
Depending on how I concentrate the force on someone, if I'm pushing, right? I might be pushing their skull, and I also might be pushing their brain. And it's not that the skull is pushing the brain, then the brain might be being pushed too, depending on how we're concentrating the energy. If it's just a slam, we have to deal with things like, is the brain going to keep moving, hit the side of the skull, and we start running into coup contra coup injuries where we have, But as an emergency provider, we just need to remember that there are, for lack of a better phrase, forces at work that we can't necessarily see, right? The exterior damage to the body isn't always the biggest concern. There is interior damage too that we may need to deal with. So we need to constantly be monitoring these patients for signs of increased ICP, signs of brain injury, any neurological damage,
Cardiac contusion,
any examples of, hey, when I got force pushed, did we detach? Did we have an organ detached from a point, and now I have internal hemorrhage?
Yeah.
We're doing
Which
this.
I don't
There's
think
also,
that is a risk. I don't think we see it as much though, because I think for the most part, the force push or pull, depending on where or like if they're throwing someone with the force, it's usually everything. So it's the body, organs, everything. Which is why a lot of times you'll see people force pushed great distances and hit objects and be able to get up and continue on.
Yeah.
Seemingly like nothing happened. And it'd be like, it depends on how quickly. So if you hit an object at 2 miles per hour because the force user pushes your entire body at 2 miles per hour, you're probably not going to damage anything, right?
Right.
Now, granted, the difference is if there was decelerations injuries within the body, that would be different.
Yeah.
But we don't usually see that as often.
right.
So
And I think at least in fighting styles, like we're not using these put like a Jedi or a Sith isn't necessarily, or just Force user in general, isn't in a fight necessarily trying to use a Force push to hurt you. They're trying to use a Force push to knock you off balance or to literally move you so that they can have an advantage to do the damage with the lightsaber. Right. So you are absolutely right. We have seen people move great distances and kind of, depending on what object they strike, just dealing with that external damage. One thing we have to worry about is there things moving with the body, though, right? So this is very similar to explosion injuries. We're going to take the impact of the Force striking us. We're also, we call that like primary, right? And then there's secondary, the object that we hit.
Yeah.
But then there's also tertiary. There's the objects that are flying through the air with us. So if I hit something with a smaller mass and you at the same time, let's say, for instance, Darth Vader breaks the window and he starts sending objects with Luke, right? Those objects could strike Luke, and then we've got damage from those. So you might see someone who's gotten thrown 20 feet, they hit a wall, you've got some back bruising, you expect that because they struck the wall, but you're wondering, why is there damage on the front and why is there damage, because objects hit them in air too. So we just need to be constantly assessing. This is why head to toe is so important in really any trauma, but specifically for force-related injuries.
Yeah, absolutely. All right, I think that pretty much sums up what we wanted to cover today. Do you want to sum up kind of the important highlights of what we've discussed?
Yeah. First and foremost, like any scene safety, right? What caused this injury is a dangerous weapon or dangerous forces that are involved. So are the Force users still in the area? Do we have proper police and or Jedi Sentinel protection? Can we secure that weapon? When we have that weapon and maybe we can't necessarily consider it, can we disconnect it? Do we understand how to disconnect the housing and remove the crystal so that it's not a threat? Are we entering environments that we just shouldn't enter, that we're not trained to enter yet until that scene is secured? So first and foremost, don't injure yourself, right?
Right.
Second, then now we deal with the victim. Usually we're looking for, either amputations we're dealing with, or we're dealing with major trauma to the torso.
Sure.
And amputations, remember, it's vaporization of tissues. We're going to have to be worried about distributive shock. Same thing with torso injuries. Just be familiar with where these organs are located. Is there internal bleeding? What is that going to look like? Obviously, the Band-Aid patch, what we're going to do at first is fluid resuscitation to handle the distributive shocks. That's what they need right now.
Right.
But before we got to do our head to toe, as we approach, think about, were forces involved? Is there a fall injury? Have they struck the ground or struck an object? C-spine precautions. Is there things that I'm not seeing, right? Stabilize, resuscitate. That's what we got to do, right? And then just keep in mind that this, treating from a compassion, standpoint, like, these people are going to have to go through a lot. This is going to be a long recovery. This is going to be difficult. Carrying with that empathy, showing them that you're going to be there with them through it, and that the healthcare field is going to stand with them, because honestly, like, the rate of lightsaber injuries we have is very low, and that's a good thing, but it should be zero, right? In an ideal world, it should be zero. So we treat the distributed shock, we handle C-spine precautions, we stabilize them. Then we got to start worrying about infection risk. Are we using dry dressings on the third-degree burn areas? Is there internal burns we can't see? Can we calculate the rule of nines to get the appropriate amount of fluid in? Lots of secondary, tertiary things that we need to worry about. So just kind of having an idea of what we're dealing with. It's not just a hole in the body. It's not just a missing hand. There's a lot more in play.
Absolutely. Taking it back to basics one last time, just going back to what you talked about in the beginning, is understanding the mechanism of the lightsaber. If you are not careful, you really need to know what you're dealing with, right? Like, like I said, these are rare injuries, but you definitely don't want to be the guy who doesn't understand the lightsaber and you accidentally, turn it on upside down and injure yourself, or you put it in your pocket and it turns on accidentally, or, that sort of thing, tossing it to your buddy in the back of the game. But you just got to be real
you got to be
careful.
very careful.
Yeah.
These devices, they're not like, it's not a trigger mechanism. There's no safeties on these things, right? It's a one button press.
Right.
And, and sometimes that button can be activated with a tiny bit of the force,
and that,
projected
I think
into
that
it.
is, I think that's a good place to end, actually, too, is like, if you feel like you have maybe any force abilities at all, or you're questioning whether or not you have force abilities, just keep that in mind, right? I would seek some guidance in that. Maybe
get help, get support.
Yeah, get some support, because you don't want to run into where you accidentally trigger things in these kind of environments that you maybe didn't intend to.
Right.
So awesome. Well, thank you guys so much for taking the time to be with us today. Again, happy May 4th. May the 4th be with you. And again, if you guys have any other questions or follow-up you want to touch base with us on regarding Lightsaber injuries, one thing we didn't get into is blaster injuries, which that's a whole different story. Yeah, but anyway, feel free to reach out to us at any time. training@sightsandsirens.com. We appreciate you guys taking the time, and we will see you next week.
Stay sweet.
Start off with just like the lightsaber itself.
What's a lightsaber?
Yeah,
right?
exactly.
Because a lot of people go, what a lightsaber is actually an energy power field.
I want to talk about how these present, kind of what's the main cause.
Sorry, it's so serious. It's so good. This is a lot I got to get through, man. When I start talking about Kaiba crystals, it's gonna be insane.
I don't want to be harsh on these people.
The kind of nerve that you have to get through a treatment process in order to get those mechanical spider legs. In order to get through what needs to be done in order to get mechanical spider legs.
Right.
The kind of focus to get through the treatment regimen you need to have mechanical spider legs. I can't do it. I can't say mechanical spider legs.
Well, and honestly, too, I mean, like, you think about the PTSD these guys have.
Let me get into the emotional effect.
There is definitely the risk of self-injury if you don't know how to operate a lightsaber. Like opening it up backwards, putting it in your pants, and accidentally getting it turned on, that kind of stuff.
Hey guys, hope you enjoyed the episode. If you're an EMT or medic student, or an advanced EMT student, or an instructor of those students, we have a program just for you. With Sights and Sirens NREMT prep program, you get video lectures, over 15 hours of really vetted, great content to help you through your program and help you prepare for the test. Check it out at www.sightsandsirens.com.